डॉक्टर फौजिया काइंडली इंट्रोडक्शन अपना करवा दूं.
I am Dr. Fozia and I am project coordinator with NIMSS.
Okay, thank you very much. Let's pass on to Dr. Amir.
Assalamu alaikum. I am Dr. Amir and I am heading NIMSS, and we are in the process of launching the first e-learning of paramedics all over Pakistan with the support of NIMSS, and with us we have this team of NIMSS and our RT Peshawar.
Okay, thank you very much, sir. Let's pass on the Peshawar. Peshawar, kindly अपनी introduction करवा दें.
Assalamu alaikum. This is Yasir Ali Rashid from Peshawar, working as Deputy Director MIS, and we are here to test the online learning system. Thank you.
Okay, thank you very much. I am Jawad Akbar and I am working as a manager IT in NIMSS, and I am now serving as a facilitator for this lecture. So I will pass on to Dr. Ezra for the formal lecture. Thank you very much.
Assalamualaikum. I hope everybody can clearly listen to me. I'm just going to teach you what is public health. The public health topic is not only related with one, it has different topics which is related with different diseases. Public health is a subject which deals with the community health awareness regarding prevention and cure of some communicable and non-communicable diseases. The subject will be taught within a period of 2 to 3 months on various topics. Today, the topic which we are going to tell you is about the hand wash, which is very important in your life, because there are many diseases which are passed from the hands through your mouth into your body system and causes various diseases. Now, as already introduced by Dr. Amir, that I'll teach you the subject, and I'll also video will be demonstrated to you in which various steps are taken how to clean your hands before and after you do some procedures, or before you take food and then after you had taken your food. So any question which you want to ask after looking at the video is in English, और आपको मैं उर्दू में बाद में बिल्कुल बताऊंगी in case if you don't understand. Thank you very much. So now we can just show you the video. Now, this video is in English and you have to just understand it yourself and see each and every step very carefully. And later on we can tell you in Urdu, and if you have any question that can be answered. आपने वीडियो को देखा और उसमें तमाम वो स्टेप्स बताए गए कि आपने हाथ किस तरह साफ करने हैं, हाउ यू हैव टू क्लीन योर हैंड्स बिफोर यू स्टार्ट अ प्रोसीजर, और व्हाइल बिफोर यू ईट योर फूड, or before you do some work, or like children, they go out and they do various things, and then when they come back, how the mother or the parents or any of the nanny has to teach the child how to clean the hands. The steps which which you saw in the video are taken one by one. Even if you cannot do all the steps, at least 70% of the steps should be taken in order to clean your hands, face and feet. And like you see in Islam, when we say our prayers, that is 5 times we say the prayers, and we have a very specific way of cleaning the hand, face and the feet. And that shows that how important it is to be clean and tidy, and your hands and your feet should be very clean and your face should be very clean. Now what we wanted to say, you can see a whiteboard on your laptop where something is written as importance. Importance means zaruri cheezein. The most important step for healthy living is to keep away the germs and remain healthy through proper hand wash, right? Then number 2, since your childhood you all must have been instructed by your parents to wash your hands regularly. यानी जब से आप बचपने से आपके वालिदैन आपको हरदम यही इंस्ट्रक्शन देते रहते हैं कि आप अपने हाथों को रेगुलरली साफ किया करें, और वो तरीके भी बताते हैं और आप उनको फॉलो भी करते हो. Third is, even if we observe the steps before we are saying our prayers, we all wash our hands, face and feet. ये मैंने आपको पहले भी बताया है कि नमाज पढ़ने से पहले एक खास तरीका है जिससे हम हाथ, पैर और चेहरा अपना साफ करते हैं और फिर हम नमाज पढ़ते हैं. अब ये तमाम स्टेप्स आपको वीडियो में भी दिखाए गए हैं, except that we could not show you how to wash the feet, which is also one of the parts when you are going to say the prayers, even in your day-to-day life. When you come from a dusty place, आपके जब पैर गंदे हों या मिट्टी उनके ऊपर हो तो आप उनको जरूर साफ करते हैं. जब पैरों को साफ कर लें तो उसके बाद अपने हाथ जरूर साफ कीजिएगा. According to the Center for Disease Control, that is CDC USA, ये एक बहुत बड़ा इदारा है जो कि अमेरिका में एक जगह है, एक स्टेट है जिसका नाम है एटलांटा. वहाँ पर जो कि इन्हीं चीज़ों पर all communicable diseases, that is the public health से डील करता है. One can pick up germs from various sources and infect yourself with dirty hands. यानी कि आप अपने हाथों को, अपने चेहरे को, अपने पैरों को कहीं से भी जर्म्स कैरी करके ला सकते हैं, और इसलिए you are at a risk of catching any disease through various microorganisms, bacteria and viruses. माइक्रोऑर्गेनिज्म वो ऑर्गेनिजम्स होते हैं जिनको कि हम दूरबीन यानी कि एक माइक्रोस्कोप से देख सकते हैं. फिर उनमें बैक्टीरिया होते हैं, वायरसेस होते हैं, और ये बैक्टीरिया और वायरसेस ऐसे जरासीम हैं जो कि आपको किसी भी बीमारी में मुब्तला कर सकते हैं. यानी all these microorganisms, bacteria, viruses can cause any disease which can later on be very dangerous to your health. You as a medical technician, यानी आपकी जो फील्ड है जिसमें कि हम आपको ट्रेनिंग दे रहे हैं, it is you are very important because day to day you are in touch with the public. आपके पास लोग आएंगे अपने चेकअप के लिए, वो खास तौर पे वो मेडिकल टेक्नीशियन जो कि लेबोरेटरी, एक्सरेज, फिजियोथेरेपी में जिसमें हर वक्त आपका ताल्लुक पेशेंट के साथ होगा, उसमें ये जो आपका जितना अवेयरनेस होगी और आप अपने पब्लिक को बताएंगे, the best thing is that you will prevent so many diseases in a community. You as a medical technician students have to work in a medical diagnostic department. Diagnostic यानी तशखीस वाले डिपार्टमेंट में, and will be directly in touch with patients, instruments, samples. You are prone to have any disease transmitted. इसलिए एक मेडिकल टेक्नीशियन खुद अपने आप को जरूर सफाई में रखे, यानी he has to clean his hands and the way it has been shown in the video, and he has to also instruct the patient walking out of your lab or your X-ray department how to keep himself or prevent himself from any communicable and non-communicable disease. This may result now various जो कि आपको मैंने पहले भी बताया, again I'm going to repeat the same thing, कि these microorganisms can be very harmful to your health and can cause mild to severe infection to yourself and the others. The source of infection to your hands are normally from the dirt, यानी कि आपको कहाँ कहाँ से infection हो सकती है. That is the dirt around the room, coughing, sneezing. Even कि अगर आप किसी बीमार के साथ बैठे हैं या कोई ऐसा आदमी है जिसे खुद नहीं पता कि मैं कोई बीमारी कैरी कर रहा हूँ, he may cough or sneeze, यानी कि वो छींकने से और उसके खांसने से वो आपको ट्रांसमिट हो सकती है. बच्चे जो प्लेग्राउंड में खेलते हैं, even young boys playing in the playground, touching pets, other outdoor activities, visiting the hospitals, etc., they can all the source of infections and can cause you any disease. Now that you have listened to all, I can just give you a little percentage of data which was collected by CDC in USA. One of the 5 people do not wash hands. यानी में से 5 लोगों में से एक आदमी जो है वो हाथ नहीं धोता. 83% of the adults wash their hands after use of the bathroom. 32% wash their hands after coughing and sneezing. 21% wash after handling money. 42% after touching their pets. 58% female students and 48% male wash their hands. This is a data which is collected more or less by CDC in USA. It cannot be 100% right, but this is what approximately they have been observing through their surveys. सर्वेज का मतलब ये होता है कि जब आप किसी खास इलाके पे जाकर आप उसका सर्वे करते हैं, देखते हैं, पूछते हैं लोगों से, एंड देन यू वॉच ऑल्सो व्हाट इज हैपनिंग एंड व्हाट इज नॉट हैपनिंग, एंड देन यू मेक आउट द परसेंटेजेस कि इतने लोग ये काम करते हैं और इतने नहीं करते. In the light of the above data, we can realize that we still are to be educated in hand washing. यानी इससे आप अंदाज़ा लगाएं इस जुमले से कि इन स्पाइट ऑफ कि हमारे पास ये डेटा मौजूद है, स्टिल वी नीड, यानी ये बहुत ज़रूरी है हमारे लिए कि लोगों को बचपने से, बच्चों को, बड़ों को, सबको सिखाया जाए कि कितनी इम्पोर्टेंस है हैंड वॉशिंग की. गुड हैंड वॉशिंग प्रोटेक्ट्स अगेंस्ट मेनी डिजीजेस like common cold, which can be responsible for 22 million people infected. It may lead to any serious disease like meningitis, hepatitis A, hepatitis C, any skin diseases, viral infections, allergies, and the most common is infectious diarrhea, which is very, very common in children and in infants. Now, as you have seen the video, जिसमें कि आपको दिखाया गया, you could actually see how the hands are washed. First is you wet your hands with water, apply soap or the antiseptic lotion. आपके ज़रूरी नहीं है कि आपके घर में हर वक्त एंटीसेप्टिक लोशन हो, तो आप आम साबुन, any soap can be very, very helpful and clean your hands. Then is wash your palms and back of your hand. palm का मतलब है हथेलियाँ, और back of the hands, thumbs between the fingers, around the wrist and underneath the nails. Remember to rub your hands together for at least 20 seconds. Rinse off your hands. Rinse का क्या मतलब है? धो लें. फिर आप पानी के नीचे रख के अपने हाथ को धोएं और इस तरीके से धोएं कि आपकी कलाई से पानी उंगलियों से गिरे. Dry your hands with a clean towel. अगर clean towel आपके पास उसका तौलिया वहाँ नहीं है तो टिश्यू पेपर है, या इनकेस अगर टिश्यू पेपर भी नहीं है, टावल भी नहीं है, तो आप यूं कीजिए कि अपने हाथों को सिर्फ वैसे ही रहने दीजिए, वो खुद ब खुद खुश्क हो जाएंगे. That is how you should do, and I hope you understood all the steps which has been written on the whiteboard on right in front of you. Right. Now that I think we have to again listen to the video which will be demonstrated to you, and watch the video carefully and try to observe the steps taken in the hand wash. Remember, hands में ये वही बातें हैं जो मैं आपको पहले भी बता चुकी हूँ, लेकिन आपके सामने चूंकि आपका सारी डेमोन्स्ट्रेशन या आपकी पढ़ाई अंग्रेजी में होगी, इस वजह से मैं फिलहाल तो आई एम टॉकिंग इन उर्दू as well as in English so that you can understand it properly. Remember, hands may wash with any type of soap and any antiseptic lotion. ये मैंने आपको पहले भी बताया है, अब लिखा हुआ भी आपको नजर आ रहा है. You must note down that the technicians working in the operation theatre, emergency accident department and diagnostic departments, जैसे X-ray हो गया या laboratory होगी, are to wash and scrub their hands properly before touching any instrument and the patient. The video which is being demonstrated will show you the steps and guide you to teach each other starting from yourself of future. Now, after you see the video and you have properly seen and watched every step, you can then ask the questions, and so that we can answer you. वीडियो अगेन मुझे जाना चाहिए.
एक्सक्यूज मी डॉक्टर अजरा, मेरा क्वेश्चन है, जब तक वीडियो चलती है आप प्लीज़ अगर इसका जवाब दें कि क्या हॉस्पिटल और लैब में हमें जो ये पानी का नलका है उसको हाथ से खोलना होता है या उसके लिए हमें कोई दूसरा तरीका इस्तेमाल करना होता है?
ज़्यादा नहीं है हमारे यहाँ पर कि आप उनके हैंडल वाला हो. वी तो नॉर्मली in very advanced countries and in very proper places you have to open the tap through your elbow. You use your elbow if the handles are long, but in these cases you have to open it with your own hands.
Thank you.
Any other question, please, from anybody else regarding the video or hand wash? Dr. Fawzia? Dr. Fawzia.
हाँ जी.
हेलो.
हेलो.
हाँ, did you see? हाँ, आपने वीडियो भी देखी और थोड़ा सा जो लेक्चर था मेरा वो भी सुना. And do you have any question regarding the video or any other question which is related with the hand wash?
Sure. You have just mentioned that at least we should rinse our hands for 20 seconds. What is the maximum limit for it?
For rinsing your hand?
Yeah, sure.
The maximum is not more than 30 seconds. That's more than enough.
Fine. Mm-hmm.
Any other?
Is it necessary to use antibacterial soaps or any medicated soap?
There is no hard and fast rule as far as the soap is concerned. You can use any soap if you don't have any antibacterial soap like the Safeguard or the Lifebuoy or the Dettol soap. You can just use normal soap, or even if the antiseptic lotion is not available, it is not necessary to use an antiseptic lotion.
Okay.
Right. Thank you very much.
Thank you.
लेकिन इसमें क्या सब right. So today we gave you a little introductory lecture on hand wash, which is one of the primary things which is to prevent from communicable and non-communicable diseases, and especially it is very, very important for these boys who are working and getting the training in work in the diagnostic areas, and they can transfer this knowledge to all the patients, and slowly it will be communicated to the public, and then everybody will be knowing what is hand wash and how it is done and how much importance hand wash has. Thank you very much, and I hope you enjoyed the lecture as well as the video which was demonstrated to you. Thank you.
Thank you.